Okay, welcome to Smarter Athletes once again. Today we're talking about injury prevention and management. And when we say we're talking about injury prevention and management, we are talking about both acute and chronic injuries, and those types of injuries that are most common to the sports that we play. We want to be able to understand not just the causes, but the methods of treatment for injury if and when they do occur. And in the long run, we do want to understand how to kind of prevent recurrence as well. Reasons for talking about it should be pretty clear to you as higher performing athletes kind of looking toward the next level of competition, but these are the big three. Injuries cause decreased performance, mainly due to detraining. They take us away from our daily training environment. And they cause retirement from sport. For a lot of us, injury is the reason we decide one day to stop what we're doing and either just switch into active for life mode or taking up something else and just kind of leaving the sport altogether. And lastly, injuries lead to other injuries. I see that all the time in my role, that one injury kind of leads to another, and often that's a result of poor movement or compensation or an early return to training and competition before the athlete's actually ready. So it's definitely one of the biggest reasons for making sure we understand injury and recovery and management, just for the sake of not getting injured again. So by developing a better understanding of injury management, prevention, treatment, we're certainly going to be coming away from this a lot more likely to kind of manage injury ourselves, and hopefully mitigate the risk of injury happening to us. So let's go through this in parts. Today we'll start with identifying types of injury, chronic versus acute injury. We'll talk about different treatment modalities for injuries. We'll definitely talk about prevention methods, and then lastly we'll kind of talk about this in summary and kind of refer to everything as a means of injury management for the athlete. So starting with types of injury here today, we really want to recognize two types, chronic and acute. And first we'll identify chronic injury. Chronic injury can really happen to any athlete, and most often a chronic injury is something that's caused by repetitive stress to a joint or limb. So chronic injury is commonly caused by an excessive training load over a high amount of volume. Mainly something like a poor movement pattern or insufficient recovery between training sessions can lead to chronic injury. We also see chronic injury creeping up in people with poor nutrition or hydration habits, and a lot of the time it's a combination of everything that I just said. So chronic injuries not caused by one immediate circumstance like a car accident or a fall, but a chronic injury is caused by a repetitive stress, usually a repetitive sport-specific motion in our case. So things like shin splints or jumper's knee, those are both great examples of chronic injury. And at this point, you might want to start to consider some of the chronic injuries that pertain to athletes in the sport that you play. Going a little further, you might also want to think about how those injuries are caused. So when we think about things like tennis elbow, or frozen shoulder in swimmers, we want to think about how those injuries are caused, usually through poor movement mechanics, a lack of strength, maybe a little too much too soon, a little too high volume, and a little too little recovery. Those are all kind of leading causes of chronic injury across the board. Moving on to acute injury, we want to recognize acute injury as something that can certainly happen to any athlete as well, but it's far more likely in a high-speed or contact sport. So an acute injury is definitely always a result of a single or high-speed incident like a collision. Many acute injuries do involve contact, but there are certainly so many that are non-contact as well. A non-contact acute injury, for example, could be something like a knee injury, maybe a torn ACL, for instance, caused by an athlete who decelerates improperly and just puts too much sheer force on the front of the leg, the anterior tibia, and just as a result of that sheer force, they end up with a cruciate ligament tear like an ACL tear. So other examples of acute injury, are things like fractures, concussions. Those are all examples of acute injury. Again, thinking now about how they might occur in your sport is a really good idea. And at this point, just to kind of move along, I like to kind of use this in a lecture setting sometimes to kind of guess chronic and acute likelihood of injury here. So we've got a few different athletes here kind of, and we want to kind of understand that all of these athletes in their sport specific settings are definitely prone to both types of injury, but it's more likely that each one of them has kind of this individual risk category. If we were to kind of divide the likelihood into two different types, we could say a chronic to acute likelihood might be 90% chance of chronic, 10% acute for some, and the opposite for others. So if we just kind of flip these all around here, we'll kind of see some kind of estimates, and these are my own estimates, but we're kind of looking at different sports now and different likelihood of injury type, chronic versus acute. So if you remember the athletes that were on the original sides of these estimates, and these estimates, once again, they're just made by myself, you might start to envision yourself in some of these categories as well, and it's really here that you can start to develop an understanding of which types of injuries you might be most interested in trying to prevent and manage. So let's move on to treatment modalities here. When we talk about athletic injury, there's all kinds of people out there that are meant to be able to help you manage these injuries, and there's also all sorts of treatment modalities that people can really manage themselves. So if we look at professionals in the business of injury management, those are people like massage therapists, physiotherapists, athletic therapists, chiropractors. They can even be people like myself, a strength and conditioning specialist. They can certainly be sports medicine doctors and beyond. But let's talk about self-management as well, because it's really important that athletes begin to understand things like active recovery for themselves through things like foam rolling and low resistance spinning or pool running, myofascial release through their own self-issued massage, hydrotherapy, hot cold water therapy, and then of course heat therapy and ice therapy as well. Those are all methods of self-managed treatment modalities, and there's certainly other ones out there as well. When we're talking about injury prevention, this is something that I really kind of take a pretty strong hold on, or I'm pretty passionate about, because that's I would say probably the biggest role that I serve here at Bill Carruthers Secondary School as a strength and conditioning specialist and the coordinator of the strength and conditioning programming that goes on here. My primary role is making sure athletes have the means to access exercises and methods of exercise that are kind of geared toward keeping them healthy and keeping them in the sports that they love. And in simply definition, that's injury prevention. So causes of preventable injury. The most common causes of preventable injury are a lack of mobility, a lack of stability, and a lack of strength. And those are all three areas where I work quite often. So starting with a lack of mobility, we're talking about a poor range of motion and a poor ability to move freely. Moving on, in a lack of stability, we're talking about poor proprioception, poor balance, and poor postural control. So these are people who just don't necessarily have the unilateral stability. One side's a little less balanced than the other, or they don't necessarily have good control of their posture in an upright position or a challenged position, and as a result, they're more susceptible to acute injury. And then lastly, a lack of strength. I can't say enough about a lack of strength being caused by poor muscular endurance, the ability of muscle to just basically take the abuse that you put your body through during sport, during competition, and during sport-specific training, and physical contractile strength, so the ability to produce that one-time force that sometimes can throw people out like acutely. So when you talk about somebody throwing their back out or straining their chest or shoulder muscles in a one-time single repetition event, we're talking about a lack of contractile strength. But going back to that poor muscular endurance, I see that so much with athletes who kind of injure one area of their body simply because their body's just not strong enough to handle the abuse that they're putting it through. And this is a direct result of just hundreds and hundreds of hours of sport-specific practice and little to no hours of strength training and just basically doing the core work that's really required to keep that body and keep that foundation in good working condition. And if we look at it in a hierarchy, we really want to assess mobility and make sure it's there before we start looking at stability. And likewise, we want to make sure that stability is there in really good full form before we start looking at strength. So this is a continuum, and we certainly don't prescribe high loads and volumes of resistance training to somebody who lacks stability and mobility. Um, Mobility is truly the foundation. Mobility is probably the biggest reference we can make to movement and healthy movement. It is followed by stability. People that have good proprioception and the ability to kind of activate their core and control their posture and through certain movement patterns. And then, of course, we can start to integrate strength and focus on adding resistance to the movement to really kind of build that final piece on to injury prevention. But it's really, really important to understand that injury prevention starts with mobility, graduates to stability, and then finally brings strength. And all too often we see people who think that the short-term answer to their common ailments and frequent injuries is dealing with some strength work, and right away they want to kind of start lifting weights and building up stronger muscles that can allegedly tolerate more abuse. And while that may be true in fact, they really do need to start with the foundation, which is mobility and stability first. So let's isolate these three individually, just to kind of identify some traits that are kind of consistent with poor and healthy mobility. When we're talking about poor mobility, we're talking about things like high resting tension, joint pain and stiffness, a low degree or shorter joint angle, and unilateral differences between one side and the other in terms of the range of motion respective. And on the healthy side of things, we're talking about relaxed muscle. We're talking about pain-free joints and joint laxity, then free movement that really doesn't cause any hindrance or pain. We're talking about longer or larger joint angles, and then symmetrical balance. So we're looking at one side being able to perform the same range of motion as the other. Moving into stability, we see a similar pattern here. In poor, stable people that have poor postural control and reduced stability, we're looking at unilateral strength imbalances. They seem to show better strength or postural control or balance on one side of their body than they do the other. And this can be simply as assessed as simply as by asking somebody to stand on one foot or hop on one foot or land on one foot from a drop landing. They have a lack of proprioception and motor control when performing a skilled movement. They're wobbly all over the place, for example, when performing something like a lunge. They are anterior dominant more often than not, meaning that the front muscle groups of their body possess a lot more strength and high resting tension than the back muscle groups. And we see this in a lot of sports like swimming, where the chest and anterior delts are overworked, whereas the lats and muscles of the back are underworked. And lastly, people that are unable to kind of perform structural load form cues. So people who have very, very high levels of difficulty performing things like a squat or a deadlift or an overhead squat. Those people are definitely not just lacking mobility sometimes, but they're also lacking stability as well. It's not that they don't have the range of motion, but if they were to execute a full depth squat or a full depth lunge, they would fall over due to a lack of stability. So healthy patterns in stability refer to things like having an equal capability of force production on both sides. I can reach the same height of jump off of each foot, or I can land off on a single leg drop landing with good balance and symmetry, regardless of whether I'm landing on my left foot or my right. I have good postural control. I'm keeping my core centered over my landing or over my foot positioning when I'm performing a lunge or a drop landing. Good posterior strength and recruitment. So those people that kind of show good posture when you're looking at them in the sagittal plane or the side view, and people that kind of have good posterior strength through the delts, through the back, through the glutes and the hamstrings, basically keeping their posture upright and erect, and also kind of showing that there isn't a massive strength deficit between the muscles on the front of the body and the muscles in the back. And then lastly, these people are kind of masters of form cues in all sorts of exercises, but especially structural loading exercises like the deadlift or the squat or the overhead squat. Lastly, when we look at strength, we want to recognize that poor strength shows a really short amount of time to fatigue, inadequate force production for the task at hand, a low rate of force production. So now we're talking about low power and recruitment. And lastly, muscular imbalances that can be either synergistic or unilateral. So when we refer to a synergistic muscular imbalance, we're talking about two muscles that commonly need to work together to perform a task, and one of those groups lacks sufficient strength. And when we're talking about a unilateral muscular imbalance, of course, we're talking about that right side being so much stronger than the left side, or vice versa. On the healthy end of strength, we're looking at people with sufficient muscular endurance to handle the task, so they're not showing signs of early fatigue during competition or training. We're looking at people who can basically achieve sport-specific benchmarks for force production. So when we compare our own personal fitness testing to people that are kind of in the exact same position we are and in same level of play, we want to be able to be around similar benchmarks. That kind of goes for the power category as well. So people who had a lower rate of force production as tested by things like a vertical jump or an Olympic lift, we have athletes achieving those same sport-specific benchmarks. And then lastly, with respect to muscular imbalance, we don't really see that in people with healthy levels of strength. We see people addressing full body strength appropriately, and these are the people that are basically always making sure that they're working on their weak side, that they have a muscular imbalance or a synergistic imbalance, that they're working on that weakest link in their chain. And these are our healthier athletes with respect to strength. So again, let's revisit that idea of an order of operation or a hierarchy when it comes to mobility, stability, and strength here. We don't really build strength without stability, and we don't really build stability without mobility. So this order of prioritization doesn't just come from like taking a sensible approach. It comes from kind of knowing that in order to truly build strength, we need to rely on a healthy range of motion in a closed chain environment, which simply put is a stable body moving over complete joint angles. And we don't really have stability until we can test it over the course of an entire joint angle, which makes reference to mobility. So it is quite literally impossible to correctly or truly have one without the one that precedes it. So once we've kind of checked off all of these categories, that's when we can kind of start to manage our own strength and conditioning as an approach for prevention. But getting into management now, let's talk a little bit about what's really in line for management. If you look at this little kind of clipboard here on the image, this is kind of how we would hope that true injury management took place. All right, so when we take those 9 steps from assessment right down to evaluation for returning to play after injury, we see these different roles here. And starting with assessment, hopefully that happens from somebody like an athletic trainer or athletic trainer on the bench for a team. Could just be a paramedic on the field. But we're looking for somebody who's qualified to make a good assessment based on what might be a potential injury. But the athletic trainer's job is not to diagnose. Following an assessment and a decision that, okay, this person needs to be looked at, it's really time for the athlete to go see somebody in the sports medicine profession who can accurately diagnose, hopefully identify the cause or prognosis, and then create a referral for that athlete. And that referral will lead the athlete to somebody in a specialized area. So these specialists could work in massage therapy, chiropractic care, physiotherapy, athletic therapy, acupuncture, and the list goes on. But really the role of the specialist is first treatment and second rehabilitation. After that comes clearance, and that's when the athlete would hopefully return to the sports medicine doctor, hopefully for some movement tests and screening to basically make sure that those same symptoms that they first initially presented after the assessment from the athletic trainer aren't still there. And at that point, hopefully a sports medicine doctor can provide an athlete with clearance to return to training. There's still the issue of working toward prevention though, and that's where somebody like me comes in. Step number 8, reconditioning. Working with a strength and conditioning specialist, a professional to kind of help you isolate the causes or the variables that might have increased your risk of getting that injury in the first place, and maybe mitigating that risk by building up some strength and working toward that injury prevention goal. following a reconditioning program, evaluation from the original sport coach, looking at the skilled movements, watching a player in their ability to perform the same way they could, if not better, from before the time of the injury. That's when the sport coach is doing a final reevaluation and giving the athlete a green light to return to play and competition. Together, collectively, these people in the green column would best be referred to as an integrated support team. So individuals that collectively are helping you manage your injury from start to finish. And that's all for today. You can always download this presentation at strongerbcss.ca. Thanks again for watching.